Okay, so we want to actually look at treatment of diabetes, then look at the various diabetes complications. That's all those diabetic ketoacidosis and hyperglycemic, hyperosmolar states. How can you treat them? Like, what are the things you can actually employ to be able to treat these things? So, for treatment of diabetes, of course, it has to do with lifestyle modifications and drugs. Okay, so there are some things that you are doing in your life that you have to stop doing. There are some things that you are not doing that you have to start doing. Okay, so things you are doing you have to stop. Things you are not doing you have to start. Okay, so also some drugs. Therefore, diabetes type 1, which is mainly the person is lacking insulin, the main treatment there is what? Insulin replacement. So let's start with the lifestyle management. So you have to actually what? Take meals that have low carbohydrate, because it's this carbohydrate that is being converted to glucose that is giving you issues, right? So you have to take food that has a lot of fruits, that has a lot of vegetables. Okay, so exercise, you have to exercise regularly just to improve the insulin sensitivity. Then frequent glucose checks, then hemoglobin A1AC checks too. All right, they have to be doing all those checks, just to ensure that everything is cool. Then medications, you have to give all those oral agents, okay, like metformin, the first line. Okay, they give all those sulfonylureas, okay, DPP4 inhibitors, all those aspart, LAS, lispro, all those drugs. The insulin therapies too. Okay, if the person is lacking so much insulin, you give more insulin so that what the cells are more sensitive to it. So for preventive care, you have to regularly check for complications. So you have to ensure that the person is far away from all those organ complications in diabetes, right? They keep monitoring the blood pressures and also the cholesterol management, just to reduce the effect of that on the heart. So diabetic emergencies is you have hypoglycemia. So the person is having low glucose levels. All right. So like they are sweating, they have tremors, they have confusion, they have seizures, loss of consciousness. All right. So treatment is they lack glucose, so you just replace glucose, right? Like using juice, candy, glucose tablets. Or if it is so severe that the person is not conscious, you have to use all those intravenous dextrose. Therefore, diabetic ketoacidosis, the person usually is dehydrated, so you give all those intravenous fluids just to correct dehydration, intravenous insulin to stop the ketone production because there's lack of insulin, so the body is now breaking down lipids to gain energy. All right, then potassium replacement to prevent hypocalcemia. Then identify anything that usually used to exacerbate the diabetic ketoacidosis. All right, because usually the crisis doesn't just start like that, right? Something like stress, infections, the rest of it. Then for the hyperosmolar hyperglycemic state, this one is a complication of diabetes type 2. Okay, so aggressive intravenous fluids because the person is usually dehydrated. Then you have to also give insulin. All right, electrolyte monitoring and correction. Then for anything that is usually precipitating it, okay, anything that is triggering this, usually try to correct. Okay, so that's what we got for this treatment.